We are live. As usual, it's myself, Kemal Erkan, and Dr. Isaias Irgau from CHRIAS. We are here on our Wednesday bariatric webinar live session. Today is Wednesday, January 20th, and this is our volume 3 for 2021. We are, again, myself is Kemal Erkan. I'm the chairman of American Surgery Center and United Medical ACO. And Dr. Irgau.
Hello, and I am Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My area of expertise is bariatric surgery or weight loss surgery. And I have been performing weight loss surgery now for about 20 years with the other surgeons at CHRIAS.
Thank you, Dr. Irgau. And so most of the people, they're already used to seeing us almost every week with different events. From our program standpoint, I do want to actually just go through our other providers. Dr. Gail Wynn, Dr. Mike Peters, Dr. Rahul Singh, Dr. Sachin Vaid, who's a colorectal surgeon, Dr. George Ibrahim, and Sydney is our surgical PA. And also our nutritionist team, Fran, Amy, and Beth, so they're part of our bariatric and diabetes program, and they are with our patients on a regular basis. Now, we are American Surgery Center. So as a surgery center, we are the first in Delaware, in the state of Delaware, with the MBSA-QIP qualification and different quality quality excellence, and there's only 15 of us in the United States. And I do want to emphasize that because that's an important achievement for a surgery center. And you can just tell there are about 9,500 surgery centers, and there are only 15 of them with this qualification. Of course, this is only possible having a good program in place. And this program includes our most expertise surgeons. Surgical expertise is not something that you are given from day one, right after your residency. It's something that you are building in time as you do more surgeries. And in bariatric, being a different specialty, we are one of the most experienced bariatric group in the United States. And with the program, we work our facility very closely. Our nutritionist, site, and other other clearances such as cardiology, pulmonary, and the primary care physician. That's part of our program. We try to cover different type of topics so that it's easy to watch for our patients. So today's topic is what can I expect after bariatric surgery, and we have Dr. Irgau who's gonna educate us and what we would be expecting after someone goes through the surgery. And Dr. Irgau, if you can maybe just give a brief background on what qualifies for bariatric surgery, and then we'll start from there.
Absolutely. Thank you, Kemal. Absolutely. And bariatric surgery really is currently by far the most effective treatment we have for the treatment of morbid obesity. And morbid obesity is defined as a weight that is at least 100 pounds higher than the ideal or healthy weight of the person. Another way to look at that is as a body mass index. When we say that a body mass index greater than 40 is the definition of morbid obesity. But sometimes even a body mass index as low as 35 could qualify a person for bariatric surgery and therefore be included in the definition of morbid obesity if that person has already developed certain severe illnesses associated with obesity, like diabetes, sleep apnea, or high blood pressure. So that's the basic qualification for weight loss surgery. But of course, the person has to be a good candidate for surgery itself. And then obviously they have to undergo extensive evaluations by different specialists, which are available through our program.
So, Dr. Irgau, the life after bariatric surgery is a really important topic for our patients. So we have, and you and I, we decided last year that we are not going to actually call this as like a patient follow-up, but more like it's a wellness part of our program, because most of our patients, they will lose anywhere from 80 to 100 pounds in the first 8 to 12 months. And that's a huge change in their life. And then we need to be able to make sure that we are able to get them ready for that. So there are certain things that they have to follow through. And if you can just take it by each section and then explain us what they need to do to follow the process.
Absolutely. So once the surgery is over and the patient has been discharged home, there is obviously a period of recovery. Now, with the way we perform bariatric surgery in our program, which is laparoscopically with small incisions, and also with the protocol we have to enhance recovery, most patients will be going home on the same day after surgery. And we expect them to be completely independent in terms of taking care of themselves when they go home. Of course, because they've had anesthesia and because it's early after surgery, we will want somebody to drive them home that day after surgery. At home, however, as I said, we want them to be completely independent. We encourage them to walk. Walking is not only an okay thing to do, but actually it's highly encouraged because it will enhance recovery and minimize complications as well. Now, clearly, because they've had surgery, a period of recovery is necessary. So we ask people to take time off from work after surgery, and that's generally about 2 weeks. Now, in that 2 weeks, it doesn't mean they are going to be physically handicapped, far from it. In fact, obviously, they will not have the same energy they have usually because they are recovering, but they are able to do many things like their physical activity in terms of walking and taking care of themselves. But we want them to focus on themselves, on recovering rather than rushing back to work so quickly, because as we know, when you go back to work by definition is taking care of somebody else's problems, right? We want them to focus on themselves, and that minimum of 2 weeks is what we ask for people to take off work after weight loss surgery. There is a protocol for progression of diet. So because of the surgery, the stomach, the intestine that has been affected by the surgery will require a period of healing. Therefore, the type of diet that person will be in has to progress according to a fairly specific protocol. So we ask patients to be on a liquid diet for the first 2 weeks after surgery. Then we ask them to advance to what's called puree diet, which is a food that doesn't require any chewing, food that has to be blenderized first. So the best way for me to explain to our patients on what puree diet is anything that they could eat without chewing. So they have to pretend as if they don't have teeth, right? So we don't want them to chew. So everything has to be chewed already before they eat it. That's the definition of puree diet. And then, of course, after that period of time, they will have been 1 month after surgery, they can introduce chewable food. That is the protocol of diet progression. And it's very important that patients stick to this, because otherwise, if they introduce chewable food too early, that could create complications. The vast majority of patients do great with this, because remember, with bariatric surgery, the first thing that disappears immediately after surgery is what? Hunger. They don't feel hungry anymore. So they don't have any problems in terms of not having the food. Of course, the actual chewing and crunching on things that is a mental habit, obviously, will be there. And so they may miss that chewing that they want to do, but the actual hunger will not be there. So patients adapt very well to the fact that the diet is, progresses in that fashion. Physical activity, we want them, as I said, to be walking from day one, from the first few hours after surgery. Walking is very, very important, and they can increase their engagement level gradually. There are certain types of exercise that we ask them not to do for the first 4 weeks after surgery. And these are exercises that require engagement of the core abdominal muscles. So no heavy weight lifting, no crunches, no sit-ups, no planks. Okay, those exercises have to wait about 4 weeks. Other types of exercise, which is like walking, treadmill, elliptical, stationary bike, all of them fine. They just have to start from a low level of intensity and then build it up gradually after that. How about medication? Well, there are certain medications that patients will be required to take after weight loss surgery for a period of time. For instance, patients will be asked to take a medication that decreases the chances of gallbladder attacks. They have to take that medication for a period of 6 months. One of the things that happens when we lose weight fast is actually we can develop gallbladder problems. So there's a medication that reduces that. That obviously doesn't apply to people who had gallbladder surgery in the past. There is a medication we want people to take to decrease acid in their stomach. They have to take that medication also for 6 months. Some patients will also be required to take a medication to decrease the risk of blood clots. That is usually taken for about 30 days. And those instructions and preparations are done well before the surgery itself. An important thing to understand, Kemal, and this is something that we cannot forget, is that patients come to us very often with illnesses that require medications, right? High blood pressure, diabetes, right? Well, those medications may not be necessary at the level they were taking them before the surgery, because as they lose weight, their blood pressure improves, their blood sugar improves, right? So one of the things we ask them to do is to actually make sure they have an appointment with their medical doctor, with their family doctor early after surgery, because they may need to reduce the blood pressure medications. In some cases, they may have to stop the blood pressure medication completely because their blood pressure may normalize after weight loss surgery as early as days or weeks after surgery. The same thing could happen to their blood sugar as well. So if they were taking diabetes medications, we want them to lower or even stop taking them because their blood sugar could normalize after weight loss surgery. So these are the immediate things that we will be very interested in making sure the patients know and follow right after surgery, Kemal.
So I do want to go back to remember, we are going to take each of these topics later on in different sessions. So yep. We want to kind of give the overall changes, but can you tell us about this hunger problem? So you said that patients won't be hungry anymore. So
absolutely. So going back to the procedures we do, right? For instance, let's take the most common procedure we do, Kemal. The most popular procedure in our program is the sleeve gastrectomy, which is also the most popular throughout the United States currently. With the sleeve gastrectomy, as you know, we divide the stomach and take a big portion of the stomach out. So the person is left with a very small percentage of their original stomach. So not only there is not a lot of room in that stomach, but that stomach happens to be very rigid as well. It doesn't expand. Mm-hmm. More importantly, the portion of the stomach that we take out happens to be that portion that harbors signals of hunger. So very often patients will actually not feel any hunger, and it's very common for us to tell us, hey, I have to remind myself to eat because I don't feel hungry at all. So that is a very, very common experience, particularly in the early weeks and months after bariatric surgery.
So Dr. that's kind of important. So then because we have so many of these sessions, so people actually can learn this in, like, if they want to have more like, just like a webinar type of setting, we have our webinars posted. And I do want to kind of get out of the tradition on this to kind of ask you some questions, because you are saying the part of your stomach that makes you hungry. I thought my entire stomach was making me hungry. So is that not the case?
So it is. So hunger is perceived by us because of signals that come to our brain when there is decreased nutrients for energy level, right? In general. So there are many signals. Some of the strongest signals actually originate from the stomach. Okay, and they originate in the stomach because when there is not enough food in the stomach, some cells produce signals that go directly to our brain, and they say to our brain, you got to find food, right? And that's hunger. That's hunger, right? And then as soon as we eat, the production of the signals is decreased, so we don't feel hungry anymore. Well, at least that's the idea. Although in our society, as we know right now, we've lost touch really on understanding hunger exactly, or satiety or fullness exactly, because we eat so much, so frequently, very often, even without being hungry. But the actual drive that we have to look for food, that famished feeling that we get, that our patients struggle so much day in and day out when they're trying to lose weight, that disappears after weight loss surgery. They don't feel hungry. They have to remind themselves. Sometimes they have to set an alarm on their watch or their cell phone to remind themselves to eat because they don't feel hungry. And that is the drastic change because, as I said, that portion of the stomach that we remove, particularly that greater curvature, harbors many of the cells that send this signal to our brain.
So that's that makes the nutrition intake a lot more important. So then they won't be able to eat. And then you did address the medication and fitness. Now, overall follow-up care, that's where we call that more of our like wellness program. So we want our patients to come and see us, especially in the first 12 months, a little bit more frequently, and then after that, once a year. Usually, what I see is patients when they lose 100 pounds and then they feel a lot better, so they just don't want to come back to the setting. So, what can we do for those patients?
So the follow-up is very important, Kemal. That's why no matter how skilled and experienced I am as a surgeon doing bariatric surgery, I by myself will not be enough to care for patients who require bariatric surgery. We need a program. A program has to be in place, right? Because there is this selection, preparation for bariatric surgery that the program is capable to undertake. And then more importantly, there is the follow-up afterwards. And in our program, the follow-up is very important. Clearly, very early after surgery, there is going to be a frequent schedule of follow-up, right? So our patients will come back to see us in our office 2 weeks after the surgery, 1 month after the surgery, 3 months after the surgery, 6 months after the surgery, 9 months after the surgery, and 12 months after the surgery. So a fairly frequent follow-up schedule in the first year after surgery. And then that slowly decreases, but it doesn't disappear. Even in the long term, we want our patients to follow up at least once a year. Now, this doesn't mean there is no room for even more frequent follow-up if there are issues. Of course, there is. Now, this is the follow-up with the surgeons, right? But there is a follow-up with nutrition as well. As we encourage our patients to continue their follow-up with nutrition as well, and that tends to be fairly frequent soon after surgery, but obviously it decreases and it becomes an as-needed process afterwards. Even patients who have been out 3-4 years, sometimes I encourage them to re-engage with nutrition, to go back to the basics, to be refreshed as to what is good nutrition, as to what is healthy food that our nutritionists are so experienced in providing.
That's especially with the telemedicine now. So it's a lot easier to make those follow-ups. And then this applies to our nutritionists as well. And it's extremely important for us to be keep in touch with the patients because we don't want any of the issues become bigger if they're not addressed in a timely manner. Now, Dr. Irgau, we do have so many different specialties involved prior to the surgery. And we do check usually with the cardiology and with the pulmonary. And pulmonary is for the sleep and sleep apnea, more like. Now, what should they expect after the surgery for the sleep and the stress-related issues?
Absolutely. So, for instance, as you mentioned, many of our patients we found out that they have sleep apnea. In fact, many of them actually suspect it, or even they don't know that they have sleep apnea, and it's the workup that we undertake that uncovers this condition, and we want them to be treated for sleep apnea. It's very important that patients are treated with a CPAP or BiPAP machine if they have sleep apnea. But the good thing is that we know the vast majority of patients who have sleep apnea, they have it because of the weight. It's the obesity that brings the sleep apnea. So the ultimate treatment for sleep apnea is bariatric surgery. So the vast majority of patients who come to us with sleep apnea, once they lose substantial amount of weight, sleep apnea goes away, right? Which means they don't need the CPAP machine either. Now, rather than get rid of the CPAP machine by themselves because they feel they can sleep without it, we actually want them to follow up with the specialist so that specialists can, tell them when is the appropriate time for them to stop using the CPAP machine. So follow up with pulmonary from that point of view is important. There is no regular follow-up with cardiology very often because cardiology is something that we send patients to be evaluated to make sure there is no hidden heart condition that may put their surgery in danger. So we want them to be cleared by cardiology beforehand. But very often, patients will have a normal tests done, so they don't need to follow up. Sometimes some of the patients may have been under the treatment of a cardiologist for high blood pressure, for instance, because they had to take different medications. And as they lose weight and their blood pressure improves, we want them to go back to their specialist so that the medication can be tailored to that improved blood pressure. And very often, it may even be getting rid of those medications.
So, Dr. Irgau, as you know, from United Medical ACO side, we started looking into our data for the COVID-19. We have completed over 300 positive cases. The findings so far, it's almost 66% of the people who are with COVID-19, who are positive with COVID-19, their BMI also is over 30. And I know this is not just going away right away, so there will be some time to kind of see the resolution for COVID-19. Anything you would like to tell our patients with the COVID and the obesity?
Absolutely, absolutely. This is a subject that comes up almost in all the consultations I have when I have office hours, Kemal, and that is that we have actually come to realize that one of the risk factors for severe illness after infection with COVID-19 happens to be obesity. And that is really the entire population that you and I take care of through bariatric surgery. So it's important for us to let them know that treating obesity is very important. And the effective way to do that is obviously bariatric surgery. So they have come to the right place from that point of view. But then we tell them, please take care not to get exposed, avoid crowds, right? Wear a face mask when you are out in public, social distancing, washing hands frequently. These are critical things that are simple enough to adapt, but can save them from being exposed. And then, of course, now that vaccination is around, and you and I have been fortunate enough to work in healthcare, and we've gotten our vaccination early, and I know United Medical actually has produced some videos of the physicians who had vaccinations at United Medical, so that we can encourage our community to also follow up on this very, very important way for us to really protect our community as we go ahead.
So that's that's another point that I have with the some of our patients who are not actually, and some of the employees actually, some of the family members, they're not comfortable with the vaccine. And I know you are part of our videos for the vaccine awareness, and you did have your 2 doses. I got my first one last Thursday. Anything we can tell, like I know all of our providers, they got their vaccination. So my logic usually is, and tell me if I'm not on the right direction. So I believe in everyone's expertise. So when it's about clinical, I'm not a physician, so I'm going to follow what my physicians are doing. Well, this is on the clinical setting. If 180 providers receive their vaccine without any objection, and they actually wanted to take it, and then now we are doing it, but then seeing some patients and some of the employees not taking anything, we can tell them other than just us showing them that we have done it.
Yes, Kemal, essentially what has happened is that there is a lot of misunderstanding and misinformation. Essentially, people perceive the very rapid development and approval of the vaccine as if there has been a shortcut in the clinical and scientific assessment and development of the vaccine. That is actually not true. What was very accelerated was the bureaucratic hurdles that usually are needed to approve vaccine. So the approval process that takes a lot of bureaucracy, that has been cut, right? It gets months sometimes to get committees together to look at the data. All that has been shortened, right? People got together in a very short period of time. But the actual science for development of this vaccine actually has been happening for years, because we had SARS before, if you remember, Kemal. So all these companies had already undertaken enough clinical research to develop this type of vaccine, right? What they've done in really very, very accelerated time was to really to look at the DNA of this virus very, very quickly. They were able to analyze it very quickly. And why is that, Kemal? That is because technology is so far ahead now than it used to be 30 years ago when they tried to develop other vaccines like measles vaccine. So the technology has helped us. Getting the bureaucracy out of the way helped us, but we did not take shortcuts when it came to actually doing the clinical trials. And also, the other thing is, because we had so many people infected, we were able to find volunteers to do the study easily. They had 30, 40,000 people in each arm to do the study, Kemal. So there were no shortcuts. This is a very, very safe vaccine, and this is important for people to understand.
And I wanted to highlight this just because our patients with obesity, they are at high risk for the COVID-19, and just to make everyone understand, the risk is really important. So just wanted to kind of highlight that portion.
Absolutely.
Now, one of my, probably I repeat this a lot, but I'm going to repeat it again. So one of the silver lining from what we experience with COVID-19 is these types of sessions, and how we are actually advancing from where we started. Now this is almost like a TV channel of our bariatric and United Medical ACO. We have several different events every day, but every other day, let's say. So our Wednesday 3 p.m. is pretty set, and we are going to continue doing this as bariatric surgery journey, and then we'll have more structural webinars on Tuesdays, second and fourth Tuesdays, and the bariatric support group on the first Tuesday each month. And also I have my live session, which I have different guests every week, or sometimes we don't have different guests. So, but we are sharing the overall population-related issues there from the healthcare standpoint, of course. And our YouTube channel is very well designed now that you'll be able to find different topics easily, and then without maybe, in some cases, we understand that it's difficult to watch like the 2-hour video. So that's why we are trying to make these shorter, so then everyone can actually just pick and choose what they need to learn more about what we are doing. And this is, I mean, I see maybe the only one good blessing of the COVID-19 pandemic is because we are able to put a lot of things out there for our patients to support them. Dr. Irgau, thank you again for joining me, and we'll see you next week with a different topic. And after we are done with our session, the video will be available offline as well. For us to kind of improve our communication, I do ask our patients to subscribe for the channel and follow us on social media so that we can promptly communicate with them. And we'll see you guys next week. Thank you again.